Before we get started, I have a quick favor. I've been self-funding the Finding Genius podcast for 5 years now. I've done over 3,000 episodes. And as you can see on YouTube, we're up over 1 million views on the channel, which is fantastic. The next thing I really want to push on is to get up to 10,000 subscribers. Because once we do, we'll be able to put a donate button and we'll be able to solicit donations to help keep the podcast running and to also get the Finding Genius Foundation moving along. We have a big project studying anxiety, depression, and PTSD and working on a product to help people overcome these problems because I've seen them explode recently after the last 2 years of the whole virus situation. So if you would, please subscribe to the podcast. That would help us tremendously. Give us a thumbs up and check in the description for Buy Me a Coffee. It's about $5. If you could buy me a coffee, I'd really appreciate it. It would help keep the channel going, and I love coffee. Thank you.
Forget frequently asked questions,
common sense, common knowledge, or Google.
How about advice from a real genius? 95% of people in any profession are good enough to be qualified and licensed. 5%
go above and beyond.
They become very good at what they do, but only
0.1%
are real geniuses. Richard Jacobs has made it his life's mission to find them for you. He hunts down and interviews geniuses in every field: sleep science, cancer, stem cells, ketogenic diets, and more. Here come the geniuses. This is the Finding Genius Podcast
with Richard Jacobs.
Hello, this is Richard Jacobs with the Finding Genius Podcast. My guest today is Dylan Gemelli. He works on hormone and cellular health optimization. So we're going to talk about testosterone and peptides, the performance, and HRT, hormone replacement therapy. So Dylan himself has been involved as a professional athlete. He's into biohacking for quite a long time. I guess, a stint in prison for some reason. Well, maybe we'll ask about. Eventually the big stage of Mr. Olympia, which is amazing. Very, very cool. So welcome, Dylan. Thanks for coming.
Yeah, man. Thanks for having me. I'm looking forward to it.
Yeah. Wow, you've been, tell me about your background. You've had a very interesting time of it seems.
I'll try to run through it quick. I've told the story, but it's a good one that people like. So I was actually a 4-sport athlete in high school, and then I played college basketball, and I got hurt multiple times and had to kind of shift what I was doing. And I got into acting and modeling and signed a contract right away and went to Italy to start modeling. And that's kind of where things kind of hit the downward spiral for me, because you brought up the prison stint. So essentially I, started living a lifestyle that is not ideal for anybody. I don't think of just money, partying, greed, that's kind of like that modeling lifestyle. And before you know it, I'm spending way more money than I have and can't keep up with anything. So falling into that, you are around drugs, and I started to sell drugs, which, is clearly not a good life pattern or choice with longevity. So of course, like anybody else that does that, you're going to get caught eventually. And I did. And, I had everything you could think somebody could want, but I was really miserable, honestly. A lot of sleepless, nights, and due to drugs or just being in sorrow, knowing I'm living wrong, and I got a 15-year prison sentence at 27 years old.
Whoa.
Yeah. So
Where? In which country?
Was in Iowa, actually. That's where I grew up, and I was going back and forth, and it was one of the times I came back home. And so I drained my parents' bank account, got the best attorney in the state, and actually got a suspended sentence. So that means they convict you, but as long as you're good on probation, you'll not get the actual sentence. Well, of course, being the jerk that I was, I violated it 3 times. And so they said, you don't get it. So goodbye. So at 28 is when I actually got sent to prison for 15 years. Now, I'm 43 years old. I actually was released after 2 years. The laws here are a lot different in Iowa. Well, I'm not in Iowa anymore, but you get time off and it's cut in half. And anyway, I was perfect in there, got out, and I got paroled to Maui, which is where my parents live. So I had to start my life over at 30 years old. So 13 years ago, I was living in my mom and dad's basement with nothing. And
at least you were able to, instead of living in Brutus's basement on the lower bunk.
Yeah, it was, when you think you've got everything and then you get reduced to nothing at the lowest. The bad thing is as you experience it. The good thing is you realize that if you go through that, there's literally nothing you can't handle, right? So I utilized that as a tool. I had a 5 years parole and was released in 1 year because of perfect behavior. And I had made it my goal in life to do nothing but make amends for all the people I let down, all the people that had invested so much time and belief and love into me. And that's where I met my wife, and she was the total polar opposite, never got in trouble, never did anything wrong. And, she was really great for me. I'm a very spiritual guy. No, not everybody is, and that's fine. But I kind of have just let God lead me, and I've gotten myself now to where I've built myself from scratch into, what we have today. So.
Okay. So what is it today? What are you biohacking for yourself, or are you instructing other people how to do it? Like, what does today look like now?
So I built my podcast into, I'm number 2 in alternative health, top 10 in health and fitness. And I travel, I speak at events. Once I got to get on stage from being an influencer and got invited to speak at the Mr. Olympia to the athletes with all the doctors, that's what set me into the course I'm on today. And now I work with, I speak at biohacking conventions, and I work with top level brands, and I work with doctors. I study cardiology and cellular health, and I've taken classes at Harvard and other courses with very, very highly regarded naturopathic doctors that have certified me in multiple facets to be able to talk on a wide variety of things when it comes to health, fitness, wellness. I do a lot of talks on diet, nutrition, and overcoming, people that have struggles, whether it be with the nonsense we've been fed about, like fats, for example, and overcoming things like that, and different aspects of, I temper what I say here, big pharma, and, things that are thrown out in front of people that they just kind of don't know the answers to. I try to be a beacon of light and guidance for all of those things. And it's just growing by the day, man.
So you focused on like male health or women's health or hormones in general, or what's your focus?
I was more male dominant for many years, and I've really gotten now I'm almost 50-50 men and women. I'm actually partnered with an ex-NFL player, his wife, and another friend, and we're actually opening a TRT clinic, vitality clinic, in about 15 days. I do men and women hormones, testosterone. I coach on peptides. I'm now kind of helping women in menopause. I've really taken a deep dive into that. So I'm really trying to focus on all varieties of people, as opposed to I was really professional athlete oriented for quite a while. And now my demographics very wide.
Oh, so you deal with young, old,
everything.
Whenever they have problems with hormones, or what kind of circumstances do they come to you for?
A lot of people, for a long time, it was a lot of men in their 40s and 50s that had either struggling with their testosterone, a lot of people that use steroids at a young age that had screwed themselves up. And so I really help people now. I manage blood panels, and I take the deep dives into things that most doctors and practitioners don't. You go to a doctor, you get a very basic panel. They look at it. If your numbers are in this wide range, oh, you're okay. They don't, you know what I mean? It's very, very...
The one number, if the score on something is 1 to 100 and you're a 99, you're okay, or a 1, you're okay. But if you're, 0.1, oh, it's a disaster, or 101, your life's over, and you gotta, take a drug.
Absolutely. And they don't look at things. Like, I get very deep and intricate. So if you came to me and said, Dylan, I need you to take control of my life, what do I got to do? Well, first, we're going to do very, very deep and intricate blood panels. And I'm getting into micronutrients. We're looking at like cellular health side, and we're going to get very deep into cholesterol and looking at things. And I have several triggers and markers I'm looking for that can give me at least a good starting point and outlook on, okay, we've got all these areas. Because look, man, if you come to me and say, I want to lose 30 and 40 pounds, well, if you're not hormonally optimized and your blood panels aren't in check, I can do everything under the sun, and you're going to come back and say, well, this didn't work. Well, that didn't work. And it's not going to work if you're not in the right state first, so it takes time. It's a marathon, not a sprint. And that's something I stress to everybody.
Well, when you say it takes time, so you have people that, let's say they've been overweight for 20 years, what would be their expectation? That in a month they'll be fit as a fiddle, or what?
It would depend on how the panels look. Like if I'm seeing high levels of inflammation, well, we got to get that down. We got to fix cortisol. We got to look at your liver and see, okay, what could possibly be causing elevated liver enzymes. So we got to address these things. Is your thyroid off? Because if your thyroid's off, I can put you on every crash diet under the sun. We're not going to get anywhere. So it really depends. See, the thing with nutrition, health, everything, it's very, very, very person to person specific. You get these people that go, well, just get on this diet or just do this cookie cutter layout. That's just not how it works. That's not reality. And people get expectations that can't be met. And I'm a realist, man. I lay it out. You're going to get the truth. And I'm going to tell you, look, we've got to fix this first. And it's going to take time. Or, you're pretty good here and there. So let's roll and let's see. Most people that are, 50, 60, 70 pounds overweight, they're going to lose a lot, onset because they're so far overweight and then they'll stagnate. So it's my job to figure out how do we overcome these barriers. But it's a lot of analyzing and a lot of deep looks into different aspects of the overall picture.
So, without naming names or anything, Willie, what are some examples of really difficult cases you had to deal with?
Yeah, a lot of some of the difficult things will be in either the thyroid area, and they can get very tricky because, the thyroid has a major function on your ability to burn fat. And I've had some pretty sticky situations there. I'm one of those people, if I don't have the answer, I got people that have the answers, and I have very close friends that are experts in those fields, but thyroid cases can be tricky. And then, there's...
So what kind of thyroid cases, like hyper, thyroid cancer?
Both, really. And when people have Hashimoto's, for example, it can get a little tricky. And a lot of people have been put on medications they shouldn't be, which I'm sure you've run into that quite a bit with people you've talked to. And you can have adverse effects by putting people on the wrong medications or putting them on when they don't need them. And so feeding people T3 without an understanding of T4 and the other aspects of that can be very problematic. And, another area where we have had some struggles is when people have used steroids way too young and they're shutting down their natural testosterone production way too early, and it's shutting down their ability to grow, for example, and it's causing bone degradation. You'll see a lot of guys that are massive and huge that have used a lot of steroids that have you'll see they're always injured, always having nagging injuries, and you're thinking, how can somebody this big? Well, because multiple reasons. One, when you are putting that much pressure on your ligaments, bones, and joints and tendons from all of the weight gain, you're so susceptible to injury. And then when you're yo-yoing up and down, because a lot of guys that don't understand how to use them properly, they'll gain a bunch, they'll drop a bunch, gain a bunch, drop a bunch, so much pressure. And then over time, it just wrecks your body. And there's so many problems that can occur from using steroids either too long or too young.
Well, what if you're in your 40s and you have low testosterone and you're using the supplement? You're not going to be at the level the bodybuilders are, but any danger there?
Well, I'm a big advocate of TRT when you need it, because if you're suffering from low testosterone, it ruins your quality of life. And in severe cases, it could be fatal to have extreme, and I'm talking, these are severe cases, but using the right therapeutic dose of exogenous testosterone. And I'll give you an example. So let's say you come to me and you have a testosterone level of, 175, which is extremely low. And my goal is to get you in the range of, 700 to 800 is a very, very good range where you should feel really good. It's not too high. And I like to keep my men in that range. So if I put you on, let's say I look at that number and I want to get you in that range, you need to take your dose of testosterone and multiply it by 5 to 7 times. And that's where you'll average out to what your number should be. Now, there's some extreme cases where there's a severe condition where that may not equate, but generally speaking, so if I put you on 100 milligrams of testosterone per week, you should be between 500 and 700 on your total score. So you might need to ramp that up a little bit, maybe 125. One of the issues that we see is a lot of people go into these clinics, they're putting them on either testosterone when they don't need it or way too much. And it can have an adverse effect if your testosterone's too high too long too. You don't want to be, at that super physiological number where it's like 2,000 and 3,000 like people that are running steroid cycles, because that can shorten your lifespan. It's too much. So,
well, also too, I don't think very much is spoken about it. I've had personal experience with testosterone. So I had low T. I felt tired. I didn't want to do stuff, moody, all that. And when I got supplementation, first I did the shots. It wasn't just like sex drive. It's also mental capacity. I felt like I was 20% smarter. I felt amazing, really, really good. But the shots, I guess the carrier oil affected me, and I would get lumps. And the clinic's like, oh, it's fine, just rub them. And, please, you couldn't get rid of them sometimes. I had to get acupuncture to get them down. And sometimes when the lumps would come down, they were holding a bunch of testosterone, is my guess. To some days I felt like, like a lot more was released. I tried to go to like twice a week injections of half the amount, and that helped a little bit, but And then I tried the pellets. Again, same thing. It would make a lump. Sometimes it would release a little bit too much and you feel like enraged, which is not good. Like, it was an anger that was not a normal anger. I had to be really careful when I was like that. I didn't like it. You don't feel good. And then I tried the creams. They're not nearly as effective. So I don't know, just my personal experience on, I don't know what you have to say about all that. Round out a profile for people.
No, for sure. That's a great example. And I can give you a really nice rundown on why that happened to you and then alternatives and options. So first thing you mentioned is completely accurate. It is the carrier oil can have an effect. And there's different carrier oils that are used and utilized by different compounding pharmacies. And so you could have had an adverse allergic reaction or something of the sort. And so that would be on them to figure that out, whoever was administrating it and overseeing it. So also, when you get higher concentration levels, so for instance, you'll see testosterone. I'm assuming you were probably on cypionate.
Cypionate. Yep.
Yep. And so sometimes you'll see it in 200, sometimes you'll see it in 250, sometimes you'll see it in 300. That means for people listening, which is, so if it says testosterone 200, every full milliliter or cc contains 200 milligrams of testosterone. The higher you see that on a level, the more possible pain you could have. Cypionate's an ester where you shouldn't experience post-injection pain or lumps. So if you were, there's a couple reasons aside from the carrier oil. One could be the size of needle that they were they injecting you or were you doing it yourself?
First I would go to the clinic and they would do it. And then, my wife learned how from our doctor. Then we would do it at home. It was at home. We would try the clinic, they always want to do it in your butt, the top. But they would alternate sides, but that wasn't enough. So we would alternate shoulders and like the belly, into the belly fat and then the butt. So we alternated more sites to get half the amount, 2 doses a week instead of 1, that kind of stuff. But the carrier oil was cottonseed, I believe, I started to call around and try to find other carrier oils, but I tried pellets.
Yeah, that's definitely why. I'm going to give a rundown of other things, but for you, I can already tell you that was it. That was definitely the problem. And I had a feeling, but other things could be the size of the needle. Some people will use too long or too big of a gauge. 25 is generally good, but you can actually do like an insulin syringe, and you can do a subcutaneous injection. I still prefer intermuscular into the deltoids if you're going to do that with a smaller needle. But yes, ventrogluteal is a very good way to do it where there's less risk of problem occurring, but it definitely could be that, and it could be just the technique used. But for you, it was definitely the cottonseed. That's problematic for a lot of people. A lot of people will use grapeseed, and there's other options. But now there is a new method, and it's called Kysotrex, and it's an oil form of testosterone, and it is passing through every test and showing to be not only just as effective as exogenous or injectable, but it's having less effect on your follicle stimulating hormone and luteinizing hormone, which go to 0, and less of an estrogenic effect. So it's
nice.
I still am getting more. I want more years of data, but some of the people I hold in the highest regards are saying it is tremendous. I'm going to try it myself because I've been on TRT for a long time too and get a feel for it, but it's very promising, and that's an oral form. For you, I would definitely, and I can talk to you about this off air, but we can find you a different carrier oil and try different methods and things and dosing too, and tie that in, because that's, I've been doing this so long, man. I love doing this. So in a case like yours, I love to help. And
in general, and I'm not trying to make this about me, but I figure since I've had a lot of experience, I can help other people. That's why I bring it up to you, just so you know.
It's perfect. And we need that, because I can guarantee you that what you're experiencing, a lot of people experience it, because I've seen it. So your example,
and they dismiss you. Oh, you'll be fired with the, no, sir. They stay and they won't go away.
No, there's too many general practitioners or clinics or doctors that do this that don't have any clue, and that's the problem. It's a major, and I'm not trying to throw shade on anybody or anything, but it's like when you're trying to do too many things that you're not a professional on or don't have the background on, this, what you're describing is what happens, and I can't stand it, and that's why I do what I do. So it's certainly something where you need a true professional to guide you and monitor you. Too many people either try to do it on their own or go to the wrong people. And what you experienced happens, I would say, and this is no lie, 60 to 70% of the people that go do this either try to do it on their own or have experiences like you and get completely turned off. And then it gets out in the media that it's so bad or this and that because people aren't doing it right and don't know how to do it. And also what to look at, because you need to be looking at your free testosterone as opposed to your total testosterone. And there's a ton of factors that go into what could cause your free testosterone to be low. And you may not even need TRT. So people like myself, I'm able to dig and find before we just go and jump on that route. And something else that you brought up is you talked about like your focus and your brain fog. That is a severe problem when you have low testosterone amongst many others. And when you get on testosterone, that opens up a whole new world for you mentally. It makes you more sharp, more readily available to tackle on the day, and far less days of being out of it. I'm sure you felt sluggish and not wanting to do anything and lack of motivation and lethargic. And I mean, it can ruin your life.
Yeah, I noticed in the clinic I would go to, they'd have a lot of young women that were the nurses, and the guys, as they woke up, from the testosterone, were in on them fine. But I said, do you, hormone replacement on the partner, whether you're straight or gay or whatever. If you've got a couple, let's say they're in their 50s and they barely have sex like once a month or once every 6 months, and now all of a sudden one of the two wants it constantly, what does that do to a relationship? I would think it would put a lot of strain on a relationship. So no one talked about that either. So if you're going to work on one person of a couple, you got to know who's around them and help them too, because otherwise it could ruin a relationship unintentionally.
Yeah, 100%. I thoroughly agree with you, and I've seen it over and over and over again, and it's so troubling, man, like the things that I see and that I've encountered, and what you just brought up is just one of the million. And so I really try to be one of the voices of reason and one that people can really trust and go to, and I've worked extremely hard to build my credibility as high as I possibly can.
Oh, that's great. Are you able to say any other issues that are very common to people doing the replacement?
I mean, the biggest problem that I ever see with it in terms of like side effect wise is just misuse, where people are using too much. And another thing that really bothers me is when you go to these clinics, they're gonna always say, okay, here's your testosterone, here's an estrogen blocker, and here's HCG. You do not need an estrogen blocker, and you do not need the HCG. That is so ridiculous. They'll tell you that they're keeping you on the HCG so that you can stay fertile, which is completely inaccurate and a lie. So if you were coming to me and saying, Dylan, I really want to have a kid, I need this testosterone therapy, what am I supposed to do? For me to just tell you that HCG is going to fix that is not only bad practice, but it's me just trying to get into your pocket. Is HCG a part of the protocol? Sure. Is that going to fix it? No. Staying on it long term, is that good for you? No, it is absolutely not. Same with an estrogen blocker. You should not need an estrogen blocker if you're running the right amount and dose. Your estrogen should be fine. Now, granted, if you're overweight, your body converts estrogen at a higher rate, but you're going to be overweight if you have low testosterone. So this should fix itself. Of course, we'll monitor it. And if we do find an issue, we'll address it through your diet and with some natural therapeutics before we ever go to an estrogen blocker. Now, if we're trying to stay fertile, at least during, let's say 2 years in, you say, we want to have a kid, and I went to have a fertility test and I'm drained. What can I do? You have to get on a program of HMG, HCG, and Clomid for several months if you want to stay on the testosterone. Some doctors will say to stop it, but stopping it can be very problematic, and that's an entirely different discussion. But we run this protocol, and I have seen this work on people that have been showing 0 sperm counts. But everybody's different. Just understand that when you take testosterone exogenously, your chances of having a child or being fertile, they're going to drop drastically. It's not impossible. I've seen it a ton of times. It only takes one.
Why did that happen?
So your luteinizing hormone and your follicle stimulating hormone drop to zero. And that's how your body has the ability to produce sperm and testosterone on its own. And so, for instance, if you are taking testosterone and then you stop, well, that luteinizing hormone's at zero. It's forgetting how to produce testosterone. It's also forgetting to produce sperm, and it's not going to do it. It's shutting you down is what the term is, or suppressing your natural testosterone production.
How much of a level of at TRT levels versus like bodybuilding levels, are both levels enough to totally suppress any sperm production?
Yeah, if you're taking even a therapeutic dose of testosterone, it's going to suppress you completely. It doesn't matter. The extent of the amount you're taking is going to suppress you no matter what. Now, it'll be a lot harder to recover from, and it will be more problematic at the higher the dose you go. There's a ton of different issues that can occur. But if we're just strictly talking about suppressing testosterone production and fertilization, that type of thing, any amount's going to cause this bottoming out.
What about your endogenous production of testosterone? How much if you take exogenously will your own production go down?
It's going to bottom out. I mean, you're bottoming out. Anytime that you take testosterone that's exogenous, your ability to produce its own. Now, people will run a 12-week cycle and run a post-cycle therapy. And so something like Clomid and Novadex can theoretically kickstart your natural testosterone production again. And some people that run lighter cycles will see that on a post-cycle therapy. First couple times, they're able to kick it back into going. But the longer you use steroids, the more you run them, the higher the amounts. Over time, it's not going to jumpstart again. Or if it does, it's going to be really bad. It's not impossible. And I've seen people that have been on TRT for a year or two restart their production, but it's more of an anomaly to see that than not. Now, I've put people on 8, 12, 16-week post-cycle therapies to try to fix their production naturally. I've made some magic happen, but if I'm being honest with you, the percentage of that's quite low.
Okay. So, I mean, what does, how long is too long to be on TRT, and what can you do if you start at a point where you do want to have kids?
So if you're on TRT, and I mean, it's really different for each person, but let's cap it at a year, right? Let's say after a year, you're like, I don't want to do this anymore. Can I restart my natural testosterone production? There's a chance, I would say the percentage would probably be more in like the 25 to 30% chance that we're going to get you going naturally. And it depends on why you got on it too. If you already had a severe condition going into it, then we're not fixing anything. If let's say you use steroids or got on it without the real need and you already had a higher number, chances are a lot higher we can fix that production. In terms of fertility, there's really no way for me to gauge that because it's so different for everybody. I've seen some crazy things, man, where people, you'd think they'd have zero fertility and they still have some. And then I've seen people that have barely used anything that are just drained. That's like really case to case specific. And I don't want to be one of those people that throws a number on something that's completely inaccurate.
Gotcha. What about someone that's been on it for a decade, TRT, like you said, you've been on it long term. What happens if, if you're on it? I mean, what is long term, and what happens if someone's on it for 10 years, 20 years?
Yeah, I mean, once you're on it, theoretically, you're just supposed to stay on it forever. The need is going to be there because if you stop taking it, the chances of your production, like I said, the longer the term, the chances keep dropping. And, I can't say with certainty, but I would say like 95 to 98% of the people, if you were on it 10 years and then just stopped, you're probably going to have a pretty poor quality of life by stopping because your body's never going to ever recover properly. And so production is, it's not going to be there.
There's always, you just keep going, like let's say you started at 50 and now you're 75, what have been observed in people like that?
I mean, people just stay on it and then their quality of life stays fine as long as they're not abusing it. There's so many studies out now that show, because there was a time where people would tell you it was causing heart attacks and it was causing atherosclerosis and plaque buildup and all of these things, but they're not looking at dosing and abuse and everything. And I don't have them in front of me here, but there's so many studies out now showing that those were completely false and that people live very long, full lives with no issues as long as they're using it properly. I mean, the older you get, it's really up to you on how, if you want to stop, see how your quality of life is and just see, it's really a test from person to person, but you can certainly just stay on it.
Obviously, you think it would be very unusual for someone that's like again, I was thinking of a number, 75, to still have physiological levels of like 700 to 800. Well, yeah, like everyone you know is down in the 300s or less or something, you know?
Oh yeah, I mean it's more definitely on the rare side. I don't personally get a lot of those cases myself, but I mean I've talked to plenty of people and studied. When you get to that age, chances of you carrying around a normal testosterone level are very, very low. Now, how you want to deal with that is really up to you. It depends on your quality of life and what other conditions that you have and your comfort level. And, I've had people in that age come to me and I've monitored them and they've been just fine. And there's other people I say, I don't know that that's such a good idea because you've got all these different other things going on health-wise, and I don't think it's necessary, So it just depends. But yeah, you're right. I mean, when you get to that age, chances of you carrying a normal level are not good. But I've seen some craziness, man, where people are walking around 500-600 without, at least they're telling me they're not on anything. And then,
What about the different forms of the testosterone? You talked about the oral one. How long will it be till that one comes out, you think?
That one is.
Trials?
No, that you can get that prescribed right now. And some of the doctors I hold in the highest regards have told me how well it works. Dr. Betsy Yurth is like a mentor to me, and she has her husband on it, and he loves it. She's got tons of clients on it. And they're working on another oral form right now, too. I don't know the name off the top of my head, but it's another company, pharmaceutical company. But Kaisertrex right now is the one that is showing to be just as effective as taking a shot, an injection. And, you talked about pellets and creams, and they're just not as effective, man. The creams, it takes so much more. And there's so many different other concerns there on the skin. The pellets, you already experienced that. They're nowhere near an injection and more problematic, I think, than anything. So,
about cypionate versus enanthate versus the different forms of it. Is there any efficacy difference?
Yeah. So a lot of times, like with these super long esters, you'll get a doctor that'll put you on undecanate and give you one injection per month. And then you'll notice you're yo-yoing up and down and you'll feel great for a couple weeks and then terrible. And so cypionate is really the perfect ester chain because of the half-life it has in it, where you could really get away with pinning it once a week. Now, I'm always in the camp of twice a week with it. It's still the perfect length to where I do a Monday-Friday schedule, and you're never really in these really high peaks and really low valleys. It's called peak and trough. And I've done it with blood work on people where I measure it and see how does their blood work if we do once a week injections or twice. Cypionate's the perfect length where it's a 7 to 8 day half-life. Enanthate's very close to cypionate and feasibly can be used just fine for TRT. But then you get these shorter esters like propionate. It needs to be injected frequently. Not ideal for TRT. Not that you can't, but if you want to be a pincushion and injecting constantly, you certainly can. Yeah, most people don't prefer that. But, then there's something like Sustanon, which is a blend of 4 different too long, too short esters. That was actually really created for TRT purposes. I'm not a big fan of multi-estered compounds, but you certainly can go that route. But cypionate really falls into that perfect category. I've always stuck with that. That's what I always recommend to people. But, some people, they have their other preferences. They want to try those longer esters, but you just don't feel right and your levels are all over the place and it's not ideal at all.
What about this new oral one? Is it a mix of esters or what is it?
That's a daily thing. You have to take it daily. Yeah, orally it has to be taken daily. And then there's a...
It's not a big deal though. That's like taking a supplement.
No, it's fine. It's easy. I don't have the translation here on how many milligrams it takes of the pill to get to 100 milligrams of testosterone, but there's a layout of it on how to do it. And, it's translatable to the amount of dosing that you're supposed to get properly. So it's something that I have talked about and I'm going to do more in-depth video on it and discussion, but it's definitely promising.
Okay. Well, next, any other new things coming in the world of male TRT or TRT?
Not really. That's the biggest thing right now. I do a lot of focus on supplements and peptides and things of that nature too that can help in that regard. There's peptides that have shown to help, boost testosterone production. They're certainly not like testosterone, but then there's natural supplements which can have an effect, especially for people that aren't having a severe condition. There's many alternatives there for people to look at that I try to implement depending on the situation, but it's like I say, it's so person to person specific.
Gotcha. And I guess there's the supplementation, but then you still need to fix the underlying diet and, other items in order to really make it as effective, right?
Oh, yeah. Look, I always break this down to anybody I coach, any professional athlete, any regular everyday person, doesn't matter. If I was to take diet, training, and supplementation and put them into percentages on what's the most important and have the most effect on the results that we're going to have. Your diet is going to be 70 to 75%. Your training and working out is going to be 20 to 25, and your supplementation is going to be 5% or less on the overall big picture of importance and scope of where we're going to be. Diet is everything, and diet is the hardest thing for everybody that people struggle with the most to stay consistent with.
Yeah. What about on the woman's side? What kind of new things?
I deal with a lot of women now that really are in like that menopause range, that 50-year-old range, that are struggling with testosterone, progesterone, and like menopause side effect areas. One of the things that's important for everybody, especially women, is creatine. And that's getting way more discussion now than it ever has. And people are understanding it's not just a bodybuilding thing. It's for everybody from teenagers to 70 and 80-year-olds, the importance. So that's like the biggest thing that I've been discussing and talking about right now, especially when it comes to women that have this misconception that it's just going to get you big or hold water and all of these nonsensical things that people have put out and said in the past. So that would be my biggest thing right now that I'm discussing and talking about. I don't know that there's any really necessarily new thing, but like the things that are helping the most would be in that range or in realm, or peptide range and realm for, people that are looking for alternative methods and therapies and ways of getting the results that they want.
Well, for women, is it just estrogen replacement, or I know there's like pregnenolone, there's a whole bunch of different hormones that are in play. Does anyone go beyond just, look at the whole panel of all of them? Estrone, estrogen, estradiol, everything.
Yeah, we look at absolutely everything, full hormonal panels for men and women. And some people a lot of women don't have any idea that they're bottomed out on testosterone or have low testosterone. It's just like for men, we have to have certain estrogen levels, even though testosterone's our dominant hormone. Same with women. They need to have certain levels of testosterone. And if we're off in these areas, like let's say you come to me and your estrogen's bottomed out, man, you're going to have all sorts of issues. Same with the woman with bottomed out testosterone or progesterone problems. Those are the two main areas of problems that women have the most. And just like men, and men too, also on the prolactin side, but women, it's a lot of women have low testosterone and have no clue, never have it checked, and wouldn't have any idea on it.
What does that do to them? The same that it does to a man?
Oh, yeah. Lack of sex drive, lack of energy, lack of the ability to gain muscle, sluggish, tired, inability to burn fat. It's generally the same thing. When women start to lose their sex drive, especially, you can really take it to the bank. It's probably a low testosterone problem. And a lot of women will find that in their mid 40s to mid 50s, where that's really becoming an issue. And there's, varieties of reasons why that occur. A lot of it is just because you're aging, and some of it is diet, stress related. There's a lot of reasons why it could occur. But, keeping diet, sleep, and stress levels where they need to be, which is far easier said than done, is one of the big three components on men and women, at least naturally mitigating this inevitable decline.
Okay. And what is the interplay of, not having enough testosterone or other hormones and sleep, since you brought it up?
So when you start to have these problems, that's when you can start to see health decline. Let's just, for instance, high levels of stress increases cortisol, ruins your sleep, and that makes you metabolically inflexible. So if you don't have metabolic flexibility, then you're finding that your body's not shifting between burning carbs and fats. Low sleep, less stress, metabolic inflexibility, higher weight, more problem for disease. Mitochondrial health is one of the areas that I focus on a lot. Not taking care of mitochondrial health, there's, my big partner is Timeline, and their product, MitoPure, it helps to stimulate mitophagy, which is helping to, feed our mitochondria, which is our only source. That's where we get our sources of energy in our body. Well, as we age, those start to decline. When that starts to happen, that's basically when we kind of start to die. So when you're talking about anti-aging, fixing mitochondria and helping that And addressing that is one of the ways that we can live longer and age more gracefully, more energy, stop some of these things. But, once again, not to beat a dead horse, the 3 things I brought up, controlling stress, which is far easier said than done, getting proper sleep, getting the proper diet. When you have high levels of inflammation in your body, which all correlate to the 3 things that I just said, that's when you're starting to get disease, bad cellular health. All diseases start in your cells, or if not in your cells, in your gut. Not addressing those type of issues, that's where we start to see disease. So cellular health and then gut health are what I've found and what everybody's finding are the 2 most problematic areas for disease and dying early.
So where can you help people? Are you able to do telemedicine and help people all over the U.S. or the world, or so listing where can they get help from you?
So my website is actually being redone right now, and that's just dylangemelli.com. But right now, people they come to me on Instagram, they come to my podcast, leave me notes, they email me, and I do consults, and then we figure out what can we do, where do we want to take this, and I put packages together for people, and I coach people literally all over the world. I have people in Australia, in Africa, in Asia, in Europe that I coach, South America, everywhere. I do it all, and I work I don't put my name on very many companies out there. I'm very, very particular about who I work with. I don't want to be one of those people that has 750 affiliate codes. When I work with somebody, there's a purpose and a reason for it. It's not just a money grab for me. It's because I believe in what I'm doing, and I'm trying to help build them into, what I believe that they should be. And that is something that everybody should be using. If I'm working with somebody, I want it to be something that's going to have a positive impact and help people. That's my whole mission. And that's, you come to me, you can come and hire me for multifaceted things. And I'm kind of a fix-it guy, man. It's just what I do. I fix people.
And part of the proof is that you're 200 years old.
Yeah, exactly.
Let us hope. That's very good. Can you restate your URL so listeners can find it?
Yes, dylangemelli.com, but you can find me just at Dylan Gemelli. Instagram, I have millions of followers. I'm on there all the time. And then the Dylan Gemelli Podcast, is where you can find a lot of my insights and discussions. And then I put out some of my own things, 30-minute clips of me discussing peptides or testosterone, or just, ideas and thoughts that I have too. So those are the best places to get me.
And Gemelli is Gemelli.
Yep, exactly.
Okay. Well, very good. Well, thank you so much for coming on the podcast. It's been great. I appreciate it, Dylan.
Definitely, man. Always a pleasure.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
You've been listening to the Finding Genius Podcast with Richard Jacobs. If you like what you hear, be sure to review and subscribe to the Finding Genius Podcast on iTunes or wherever you listen to podcasts. And want to be smarter than everybody else? Become a premium member at findinggeniuspodcast.com. This podcast is for information only. No advice of any kind is being given. Any action you take or don't take as a result of listening is your sole responsibility. Consult professionals when advice is needed.